everybody, Dr. John here. Just want to take a couple minutes here, a couple short minutes to talk about a study that was put out by Kenneth Handrash, Chief of Spine Surgery in New York. And this is not, this is a few years old, but it's come to become more relevant in the last few months in the office. I'm seeing more and more younger kids and children come in with massive forward head posture. And we know we talk about it, we joke about it sometimes. It should not be joked about. And the reason why it shouldn't be is because that type of posture, looking down posture, and it's relevant with our phones and our tablets, it is devastating to our cervical spine and hence our overall spine. And so what he did, he actually he quantified the amount of stress in pounds with degrees of how far someone's looking down. So here's what he found. We know this already. We know the most efficient posture for our spines and necks specifically is a neutral posture with a nice smooth curve. And they talk about this in the study. But they did found what they're focused on is how much pressure is going through the neck with each degree that we move down. And he quantified it. Basically, we know normal posture with neutral head. With our average head weight between 10 and 12 pounds. That is what the spine or the neck was designed to withstand on a day-to-day basis. What it wasn't meant to be designed for is us forever constantly looking down. And they said that basically people, and I think this is even underestimated, people spend an average of 2 to 4 hours a day with their head tilted over reading texts, reading books on their tablets. And that can equate up to 1,400 hours per year. And they're saying if you're a high school student, that might add in addition to the extra 5,000 hours per year. So what does this do? It basically says that loss of natural curve from looking down incrementally increases the stresses in the cervical spine. So at 15 degrees, there's an extra 27 pounds of pressure going through the neck. At 30, it's 40 pounds. At 45, there's an extra 49 pounds, or almost a 50-pound, this thing's heavy, a 50-pound dead weight on your head. And then when it gets to 60 degrees looking down, there's an extra 60 pounds on your neck. So if you take a 60-pound dumbbell and visualize that, or a 50-pound dumbbell, and visualize that plus the 10 that your head is already weighing, and you're forcing that through your neck, only bad things can happen. So they quote in their study, and let me just find it here, is that it leads to early wear and tear, osteoarthritis, degeneration, and possibly future surgeries. We see this in the office all the time. We see that not only does it add to these, but it increases your risk for headaches. It increases your risk for neck tension. It increases your risk for tingling and weakness in the arms and hands. It affects your jaw. People with TMJ or jaw problems are affected by forward head posture. In fact, there's research to show that if your head comes forward and you're looking down, your lung capacity decreases by 30% because the muscles that help with respiration become weak. Rene Callier, who was a medical doctor, also saw that as forward head posture was more and more prevalent, that he found that your colon was less efficient at moving things through your colon. So it affects your digestive system. And we know that Cuddy, a researcher, found that this posture is considered a weakened posture. And what that meant was that people with those types of postures and not upright neutral posture would have decreased elevations of testosterone. They'd have decreased levels of serotonin, increased levels of cortisol, which is our stress hormone. So this posture is not good for our physiology. This posture is very good for our physiology. So why I just wanted to bring this attention to you is we know that we wouldn't walk around with a 10 or 15, 20 pound dumbbell on our head. It would be devastating to our health. So when you are on your tablet, when you are on your phone or at your computer desk, or you see your kids, just become more aware. But be aware of it, change your posture, get up, stretch out, and just understand that the consequences of this over time may only result in temporary pain at the beginning, but it can have lifelong consequences and future quality of life problems as we age, especially if it starts in our children. Hope this was useful for you. Until next time, be well.